And we're back on your coffee break on the HAN Network. I'm Kate Chaplinsky, joined now by Jackie Hoyle, who is the coordinator of the Sleep Wellness Center at Griffin Hospital. Jackie, welcome.
Hello, thank you. Good morning.
Now, this is something I've only learned about recently, and when I think of a hospital, I don't really think of a good night's sleep. But can you tell us a little bit about the Sleep Center?
So the Sleep Center at Griffin, we have 4 beds total. We run 7 nights a week. We also do daytime testing for people who work shifts or work the nights, things like that. And we're a full comprehensive center, which means, we test for everything, all sleep issues. So, a lot of people, when they hear sleep issues, they think of the most common sleep disorder, which is obstructive sleep apnea. We also test for narcolepsy, REM behavior disorders, and such. So a wide gamut of patients that we see.
And how common is it that people have sleep disorders? I mean, this can be really, and does it often go undiagnosed?
It often goes undiagnosed. Probably about 25% of the population has been correctly diagnosed. But as things we're doing here, we're coming out trying to educate the population. More of the doctors are screening their patients better. So we're seeing a lot more of those patients being screened properly, therefore we're diagnosing them properly.
And how does the diagnosis process work for most people?
So what happens is the patient would see their physician in the office, they would do a screener. A lot of times spouses are involved where their significant other is snoring a lot and keeping them up at night. So that prompts the conversation with the doctor. So what happens is the physician sends the order over to us in the sleep lab for either a test or for a consultation with one of our sleep physicians. And then that gets the ball rolling.
Wow. And so if somebody does have to kind of stay overnight and get monitored, I know you guys go to great lengths to make that as comfortable as possible, right?
Yes, absolutely. So at Griffin, the rooms are pretty much set up like a hotel suite. So we like to joke that it's pretty much a timeshare. We tell the patients, look at it as though it's a timeshare for the night. But we make it very comfortable for the patients. There's mahogany finishes on everything. It's really, really quite nice. It's not, sterile. It is sterile and it's all appropriate,
right.
But it's a lot more welcoming when the patient comes in, the atmosphere.
And from what I hear, the center is kind of unusual in the state. You guys are doing something that not everyone else is doing.
That's correct. So we are accredited by the American Academy of Sleep Medicine, and that's the highest credential you can carry for a sleep lab. So that's a process that every 5 years we have to go through and be approved for. So.
Right. And now most people once in a while suffer some bouts of insomnia, snoring issues. I mean, do you have any suggestions for, what people can do if they're just not thinking that they're getting a good night's rest?
The best thing you could do is talk to your physician. If you talk to your physician, sometimes people are snoring for a bit, could be they're congested, things like that, or it could be a larger issue. So it's important if you are experiencing some issues to talk to your doctor about it, and then they would kind of see if we need to look into it a bit more.
Right. And what are some of the most common issues?
So the most common issues are for snoring. So a lot of people think because you snore you have apnea. That's not the case. Snoring is a symptom of sleep apnea. But if you're snoring and you feel some more symptoms, such as you're much more fatigued than you would be normally, high blood pressure, things like that, then it's really something to look into. If it's, you're having an issue with insomnia for a period of time, a lot of times that could be a life event, something you're stressing out about, or, loss of a family member, things like that. It should be a temporary thing. If it's lasting more than a few months, you definitely want to talk to your doctor about that.
And now, Jackie, sleep deprivation can be dangerous.
Absolutely. A lot of the traffic accidents now are related to sleep deprivation, along with untreated sleep disorders, which lead to sleep deprivation. So it's really important, we see a lot of patients who are on the road for their job, driving vehicles for their positions at work. And now what we're seeing is when they go through their annual physical, they're having to be screened for any sleep issues. And if they do show positive, they have to come in to see us, get diagnosed appropriately, show that they're compliant with their therapy to get their CDLs renewed and such.
Wow, that's really interesting. And I know you guys have a special talk coming up.
Yes,
Can you
we
tell us
do.
about
We
that?
have a talk this coming Thursday night, which is the 3rd, and it's at 6:30 at the hospital. It's in the Resource Center. And Royce York, who is the director of our laboratory, will be giving the talk about some helpful hints, how to get a better night's rest, some sleep disorders going into that a bit, but mostly, sleep hygiene and things you can do to help yourself sleep better.
Oh, that's great. All right. And how can people get more information if they can't
So
make the
more
talk?
information, they can go to the website, griffinhealth.org. Under that, you can look under, if you hit under the S there, it goes to the sleep laboratory. And it'll give you a bunch of information about the sleep lab. It'll show you some pictures. It'll also have a screener. There's also a screener attached there, so if you think you're having an issue, you can, look at that and then bring it to your doctor. And yeah, there's a lot of information online, or they can just give us a call in the main office at 203-732-7571.
All right, great. So Jackie Hoyle of the Sleep Wellness Center at Griffin, thank you so much for talking with us.
Thank you for having me.